Discussing blood pressure and cholesterol is Heart Center cardiologist Dr. Glenn Gerber. Dr. Gerber, why is control of blood pressure so important, and what can a patient do if their blood pressure is elevated?
Blood pressure is one of the most important risk factors that we treat in order to prevent cardiovascular disease. It's involved not only in heart disease but also in stroke. The patients today are living a lot longer, and so blood pressure, which is relatively easy to treat with all the medications that we have, has an importance in preventing the problems that come up in the patients that are living into the 80s and 90s. The most important of these two are atrial fibrillation, which is an irregular heartbeat, and the various types of strokes from the wear and tear of the blood pressure on the carotid arteries and the cerebral blood vessels. Today we have many medications to treat hypertension or high blood pressure, and the patients are attuned to these medications and to the various ways of monitoring. Some of our patients use the home monitoring devices that are available to help control the blood pressure, and some of them go to the various drug stores, which also have free accurate monitoring available. So we encourage monitoring on the outside as well as the in-office measurements. Some of the patients come in a bit nervous, and it's helpful if they measure their blood pressure on the outside. The various medications that we use today include different types of diuretics, vasodilators, beta blockers, and other specific medications that are designed for hypertension. Usually we can find a suitable regimen for the patients to avoid the various side effects.
How do you treat a patient with elevated cholesterol?
Cholesterol elevations are usually a manifestation of lifestyle and the person's genetics. So we have great expertise in the Heart Center in dealing with the lifestyle problems. We have nurse practitioners that work alongside with us that are trained in advising the patients of the various lifestyle modifications that they need to do to help lower their cholesterol and blood pressure. This often involves a change in diet, but most of the time we can work with the patient to try to find some happy medium. The diet today in Western countries is too high in sodium and generally too high in saturated fat. So it requires that the patients make some effort to avoid the processed foods, avoid going too often out to the fast food restaurants, and pay attention to the labeling on the foods. So we try to teach them how to do that, how to read the label, and to make these changes along with increased exercise that are helpful in reducing the cholesterol and risk factors. The medications are a second part of the treatment, and sometimes patients don't need much in the way of medication if they follow the diet. Today there are very potent medications. They're called statins, which are used very commonly to lower cholesterol, and we try to find the right one for the patients.
Do patients ever have problems with their statin medications, and what is done about it?
Sometimes the patients have problems with the statin medications, and we try to work with them to help find a proper dose of the medication. We also utilize non-drug therapy, utilizing specific foods and specific vitamins that have been shown to help with lowering the cholesterol. And we also have other medications that are not statin-based that can be used to help lower the cholesterol if the diet is not working fully.